Hello, everyone. Welcome to the Psoriasis Awareness Session. I'm Dr. Anushka Amlani from Integrated Health and Wellbeing Council. This interaction with top dermatologists from the length and breadth of India is aimed to spread awareness about psoriasis. Today, on account of World Psoriasis Day, we will be talking to Dr. S Chandrashekar, Chief Dermatologist, CUTIS Academy, Bangalore. Welcome to the session, sir.
Thank you, Anushka. Yes.
As we go ahead, I'd like to set the context for the session. Psoriasis is a disease that affects approximately 10 million people in India and is not fully understood. With the launch of Live Life Limitless, an awareness program, we aim to make an impact to the awareness of psoriasis, right from the basic do's and don'ts to the advancement in therapies. Once again, I would like to welcome Dr. Chandrashekar to share his valuable insights with us today. So my first question to you is, what is psoriasis and how does it impact the patient's life?
Psoriasis is basically an autoinflammatory autoimmune disease. I think once you say a word autoinflammatory autoimmune, that means there are some antigens within your own body which are from outside. For example, a streptococcal infection can herald a gutted psoriasis. Anything like that, it gets associated and immune system gets activated. It brings about the proliferation of keratinocytes on the skin. That's what you see as psoriasis, as a patch on the skin, which has got more scales, more erythema, and elevated plaque. So it's basically an autoinflammatory autoimmune disease of various origin. There can be a genetic background. Up to 40 to 50% of the patients can have genetic background. If both parents are affected by psoriasis, there is a much more chance of offspring getting a psoriasis. Yes.
So how does it impact the patient's life, like the mental health and the general quality of life?
Again, it depends on the impact of psoriasis, how much body area is getting affected. As we know, psoriasis has got different manifestations. It can affect skin in the form of chronic plaques. We call it as chronic plaque psoriasis. Then it can come on the scalp. We call it as psoriasis of the scalp. It can affect nails. It can cause pitting, then destruction of the nails. Wherever there is a social interaction of a psoriatic patient with the world, on the visible areas, if psoriasis is there, definitely the patient quality of life would be very, very less. I have seen patients coming to us having difficult social interactions when they have psoriasis on the visible part of their body, plus especially on the scalp. And even the hands psoriasis, palmoplantar psoriasis, when they shake hand with people, they really get affected and their quality of life is really bad. And it's got a huge impact on quality of life. Yes.
Thank you for your insights, sir. Moving on, could you share some insights about the chronicity and the long-term complications associated with psoriasis?
Since it's an autoinflammatory autoimmune disease, if somebody asks for a cure for psoriasis, our answer is no. There are situations where there can be an auto reversal of psoriasis in some of the patients, but majority of the patients would go for chronicity. Chronicity in the forms of months and years together. Okay. So as the disease becomes very chronic, there are varieties of psoriasis which can get affected. When I say it's an autoinflammatory autoimmune disease, that means the inflammation is not only in the skin, not only in the scalp, not only in the nails. The inflammation can occur in joints. At least 15% of the patients of psoriasis will get a joint psoriasis called psoriatic arthritis. Similarly, it can also affect the blood vessels, especially the cardiac effects can be there in psoriasis patients. So cardiac can be affected, joints can be affected, nails can be affected. So there are varieties of manifestations of psoriasis. It is no more a disease of skin. It's an inflammatory disease of the system. That patient should know because they have to start the treatment as early as possible to stop the autoimmune function which is happening in their body.
So what are the treatment options available to patients suffering from psoriasis, from conventional to topicals and other treatment options?
Again, it depends on the severity of the disease. So we normally, as a general rule, we take psoriasis as body surface area affecting 10% and 10% more. Less than 10%, if there are only few patches on the skin, Then we treat them topically. We have a lot of medications which are available topically in the form of corticosteroid creams, vitamin D3 analogs, calcipotriol. Then we have salicylic acid, urea. A lot of medications are available. The doctors would be able to treat them perfectly well if they have a limited disease. When there is involvement of 10% more of the body surface area, and if it is socially impacting very badly, as I told you about quality of life, it is not that systemic treatment should not be given in a patient which has got less than 10%. We can give if it is socially embarrassing the patient to a great extent. So once your topical medications are not working, or if they're not sufficient enough to control your disease, we go for systemic treatment. In systemic treatment, we have immunosuppressants like cyclosporine, methotrexate. These are the main drugs which are used, along with a vitamin A derivative called acitretin. Depending on the different forms of psoriasis, we choose the drugs. To give an example, if it's a chronic plaque psoriasis, probably I would go with methotrexate. If it's an erythrodermic psoriasis, a full body psoriasis, impacting the health of the patient very badly, probably as a crisis buster, I would go for cyclosporine. Similarly, with the palmoplantar psoriasis, which is very, very thick plaques, I would go for a retinoid. This is the second step here. There's a third step which can also become the first step. So when I talk about the recent trends in the treatment of psoriasis, they are biologics, which are definitely ruling the treatment scenario of psoriasis across the globe. Unfortunately, in Indian scenario, the cost is very high. There's no insurance coverage for a private persons. That is the reason we hesitate to prescribe biologics because of the cost, not because of the effects or side effects. Compared to the traditional treatment, biologics have got much more precision in their action. They exactly act on the cytokine which causes psoriasis like IL-17 or IL-23 or IL-12 or 23. When you talk about precision medicine, you talk about a perfect analysis and perfect outcome of the disease. So biologics are the third line of treatment in India, but abroad, biologics are the first line of treatment. Anushka, I will tell you it's simply because you have to knock down the inflammation at the earliest to prevent complications of psoriasis like dactylitis, arthritis, and cardiomyopathy. So if the affordability is there for a patient, as a doctor who is having practice of 27 years, I would go first choice as a biologic only, not even other things.
Thank you, sir, for highlighting the importance and the benefits of biologics. To convince our audiences about the importance and the advantages of biologics, could you also elaborate on why and how biologics help live life limitless?
Okay, so when you take a treatment armamentarium of psoriasis, when I talk about topical treatment, when I talk about phototherapy, when I talk about the cyclosporine, methotrexate, they have certain limit of their own. Number one limit, the time taken for the patient to respond. Number two, they have their own side effect profile which comes. Number three, the patients who are on polypharmacy, for example, patients of maybe a diabetes, hypertension, or maybe a cardiac patient. Now we have biologics which can be used in cardiac patients. Such a polypharmacy is there. It is very difficult to treat with cyclosporine and methotrexate. Number three, the complications associated with diseases in the long run, nephrotoxicity, then probably lung fibrosis, liver fibrosis with methotrexate. To overcome this, when you look at another aspect of psoriasis treatment, you have wonderful molecules which are biologics, which are called precision medicines. Exactly what works on the pathway of psoriasis, where it is supposed to be act. You take scalp psoriasis, you take palmoplantar psoriasis, you take nail psoriasis, you take erythrodermic psoriasis, any form of psoriasis except pustular psoriasis, where also we have a biologic called specilimumab now. All other psoriasis are amenable for treatment. And another advantage of biologics is that it stops the progression of the disease in the form of it prevents your cardiac problems, it prevents your joint problems. And the rapidity with which the biologics work. I still remember when I used my first biologic, one of my patient came in a wheelchair to my clinic. First dose I gave the biologic. For second dose, he came walking in the next 15 days. That is the
Wow.
impact of biologic on psoriasis patient. If you have a concept of clear skin, maybe you have suffered from psoriasis for about 10 years, 15 years without having a clear skin at all. One or the other way, one or the other area, you have a patch, always look at it, you get depressed. But biologic therapy can aim at clear skin psoriasis. That concept is the concept which has come now. Many of my patients come and tell, I want to have a clear skin doctor. I don't mind spending money. So that is the impact of biologics. Number three is that, as I told you, it stops the progression. Number three, monitoring of biologic is very easy. We have a specific guidelines to monitor biologic. We know specific side effects which come. Largely, there are no side effects except probably because they are all immunomodulators. You may have suppression of immunity. Apart from that, there's nothing is there. So it's very easy to monitor. The only flip side of biologic is the cost. Apart from that, I think if I given a choice to me in any psoriasis patient, I would vote for biologic first.
Well, everything good comes at a cost. I'm
Yes.
glad to know about the advantages of biologics, how it helps in prevention and also improvement and at a good pace. So, definitely, biologics is doing great. As we conclude this session, sir, what is the importance of regular doctor consultation in therapy adherence to live life limitless?
I think that's a very important point you brought out. Uh, if you're a psoriatic patient, probably you're a psoriasis patient for life. That means I don't say that you have a regular follow-up. I would put it as you should partner with your doctor. You become a partner with your physician, with your dermatologist. That is the level of partnership you should develop with the doctor. You need to have a regular follow-up. You need to have a proper instructions given by the physician to follow those instructions, because a few patches of psoriasis can be managed very well with calcipotriol and steroids. You don't have to depend on immunosuppressants. The only thing, you need to go to the doctor. Since it's an autoinflammatory autoimmune disease, there is a possibility that you would develop other autoimmune disorders. Probably you are more prone for obesity, you are more prone for diabetes, you are more prone for arthritis. All these things are there. So if you have a regular follow-up and regular usage of medication, you can prevent many of these. So it's very required. And the important things associated with general instructions, if you should not smoke. If you are a smoker, you should stop smoking completely 100%. No alcohol to be taken. You should have a balanced diet. The most important critical part of psoriasis treatment is your body weight. All your drugs comes with the cost, as you said, with the body weight. If your body weight is more, you're going to spend more. And if your body weight is more, it has got a direct effect on psoriasis. Obesity is the killer for psoriasis. So you should maintain your optimal weight. So you should follow those instructions from the doctor, and you should be a disciplined soldier in your life maintenance. If you want to have a good quality of life, you should maintain life limitless by having these under control. And regular follow-up with your physician. If there is any variation in your body, psoriasis or psoriatic lesions, or if there is any new symptom which appears, don't wait till the appointment comes to your doctor. Please go meet them, see whether this particular problem is related to your disease process or not. They will definitely clarify and do the helpful for you.
Thank you so much, sir. So, as we conclude, do you have a message for our audience on the World Psoriasis Day?
Yes, yes. Uh, I think this is my 27th year of practice. What I saw 27 years back or 2 decades back, what I see now, you see sea of changes. Psoriasis patients' quality of life can be improved to a great extent. You can dream of a clear skin in psoriasis. There's a huge change in the perspective of psoriasis, understanding of psoriasis. Now you can have a beautiful life in spite of having psoriasis. So don't fear the disease. You please come to the physician, come to the doctor, come to the dermatologist, speak with them, get your treatment done, follow a good lifestyle. Don't sway away from your habits. Always control them or keep it under abeyance or stop it. You will be a very good patient, and you will definitely have a good quality of life. What psoriasis was about 2 decades back, what psoriasis today, what psoriasis will be tomorrow is a change. You can expect psoriasis as an obituary disease for a period of time. because the development of precision molecules in the form of biologics as well as small molecules like JAK inhibitors is great on the way, and you can have a wonderful life ahead. So don't fear your disease. Always be with the dermatologist as a partner of you.
Thank you so much, sir. Thank you for your valuable and very interesting insights on this occasion. Thank you so much.
Thank you, Anushka.